Welcome back, everybody. A big conversation we're going to have here this morning on euthanasia. The Congress of the People, that's COPE, with Dignity SA have once again brought euthanasia and the rights of patients to the forefront. At this point in our law, terminal patients and families have not got the right to decide, in consultation with their medical team, to die or have life-supporting machines turned off. COPE is planning to introduce the draft National Health Amendment Bill that will legalise living wills and durable power of attorney for healthcare. To talk more about this, we are joined in studio by Dr. Jose Letlape. So nice to see you. He, of course, is the President of the Health Professions Council of South Africa. Thanks so much for being with us.
Good morning, and thank you for the invite.
And also in our Cape Town studios, we're joined by Deirdre Carter. She, of course, is COPE's Parliamentary Chief Whip. Deirdre, thank you very much and welcome to Morning Live.
And also good morning to listeners, and Dr. Thanks for having me.
Pleasure. All right, let's begin with you, Deirdre. Well, we've got you up there on our screen. What are the objectives of the draft National Health Amendment Bill?
But the first thing that I just want to correct, okay, this is not about active euthanasia. This is something totally different. It is about an advanced directive. It's about a living will where you would decide, and I'm going to give an example, that this is exactly the same as what would happen when you write yourself a testament or a will to say, this is what must happen to my pension, this is what must happen to my car in the event that I die. This is exactly the same. If we have a look at the National Health Act, Section 6 and 7, provides that a patient can refuse treatment. Now, it's already provided for, but it is not clear. And therefore, we want to sort of have it definitely so that no medical practitioner can have any comeback when a family is disputing it, because this will only fall into place when you can no longer talk to you, for yourself. When you, for example, brain dead or you're in a vegetative state, etc., then your will come into place. So what we are tabling is definitely nothing to do with active euthanasia.
Okay. So that's the clarification from COPE's point. Dr. Letlape, would you like to add to that?
Yes, I think it's a long-standing ethical principle that the patient decides what happens to them. People have always had the right to refuse treatment, and that's just enshrined in the National Health Act. But the challenge is that people need to ensure that when they have living wills or advanced directives, that they keep renewing them. Because what you find in life is that people change their minds.
Yeah.
And what has been experienced is that when people get sick, they want help, and they then change from the advanced directives. So what's going to be important is a process of how those can be accessed. Remember also that when you work in hospital, you don't know whether the patient has made that will or not. How do we ensure that it is current, it is up to date, and it is made available to the healthcare team timelessly so that care cannot be given against your wishes?
Yeah. So, give us an example, just to make it a lot more practical for us, Deirdre, if you don't mind. Just let's talk about a patient who has stipulated previously to getting sick that if anything should happen, that he or she does not want medical treatment, or they would prefer that the life support machines would be switched off, that they don't want to be living in a coma for months or even years on end, that they would like the decision to take their lives. Talk to me about that now. Take that story as an example.
I want to start off with the following. One thing I don't ever want, and I don't believe any of you would want to happen, is for your child to make the decision to say, switch off that machine.
Yes.
I never want to do that to my children.
No.
And therefore, that is the reason I would do that. Let us take, for example, you can have different examples. I've got heart failure. Do I want them to bring me back? That is something that you would complete on a form to say, no, you've had a massive heart attack, or you've drowned. You were in a situation when you're in a drowning, you were underwater for 15 minutes or 10 minutes or whatever the case is. Do you want them to try and bring you back and you're not going to have a normal life? What happens in the event of cancer? You terminal stage 4 cancer, you have absolutely no chance of survival. Is it the right thing to give me blood infusions or give me blood to keep me alive for another 2 days and prolong my suffering? Now, this is exactly where this will come into play, where you would say, no, please, I can't talk for myself anymore. I'm in a semi-coma, but it is inevitable that I am going to die. It is absolutely a matter of time, of days, hours, maybe weeks. Don't give me that additional treatment.
So that is where it comes into play. You have stipulated in a will that will come into effect if you are in that situation. And you're not leaving it to your family or the medical practitioners to decide. Because Dr. Letlapa, that's where I want to ask you a question, because how much power does a medical profession have in deciding on a patient's health? Because that obviously is their decision as well. When they say, I don't think we should do this treatment anymore, and they've made that decision for you?
I think we should be quite clear about what the circumstances are. And professional decision making is a part of it. So we're not talking about a living will where you willfully say, I don't want to be treated. This is about when, in terms of the professional opinion, your prospects of a normal life or your chances of survival are minimal.
Yeah.
So it needs to be restricted to those circumstances. It's not that you can decide, I don't want to be treated for diabetes, for example, because we know you can live with diabetes.
Yes.
So we would not accede to something like that. And a living will would not accommodate things like that. This is about saying, if I'm in a vegetative state, please do not prolong my stay unnecessarily when the outcome is pretty predetermined.
Yeah.
And it's about specific circumstances. It cannot be used willy-nilly. But what you need is for the professional opinion of the doctor to say, in this case, prognosis is poor, the chances of coming back are not there, here are the statistics, here's what happens in patients that are in this state.
Okay.
Then if it is a living will, there will be no active pursuit of treatment. But there would be no active intervention to terminate your life.
Yeah. Yeah.
Which is what euthanasia is about.
And
we will not keep you on a ventilator when it is futile.
Yeah.
We will not give you chemotherapy when the outcome, because of your state, is not going to be good. You end up with unnecessary expenses.
Yeah.
That's where a living will or an advance directive would be applicable.
Would kick in. But as it stands right now, in South African law, this does not exist.
It's not that it does not exist. As has been explained, there's provision for that in the law, but it is not explicit. And we have not developed the mechanism of how we can make sure that it is clear.
Okay.
And I guess what COPE is trying to do is to ensure that you don't get into disputes where the document can't be found, there's hearsay, the families are in dispute, the one child says, no, that's not true. There should be a legal document that is quite clear, that is enforceable, that protects the survivors, that also protects the profession.
All right.
And we've got to ensure that it's a legally sound document and there's a defined process. In other countries, they have living wills, but they have a shelf life. You've got to renew it within a certain period.
So because you might have changed your mind.
Because you might change your mind.
Absolutely.
Those are the things that need to be determined. It's like you have a passage in the Act. We now need the regulations to give it life.
Okay.
And I guess that would be what COPE would be wanting
would like to do. Okay, let's quickly take a break. We'll continue this discussion afterwards, including some of your comments. And I can see Deirdre writing notes frantically, so we'll go straight to her and get her views and opinions on all of this. Stay tuned.